Hello, all. Our today's topic is again fungal pathogen, that is Candida albicans, part 2. Today, after morphological characteristics, colony characteristics, as well as after pathogenicity and predisposing factors, we'll see in detail pathogenesis, various symptoms, as well as a laboratory diagnosis, epidemiology, prophylaxis, and chemotherapy of the diseases caused by fungi Candida. Here, in the pathogenesis, first we have to see how this microorganism enter in the body. So, as you know, this is endosymbiote, that is commensal normally present on our skin as well as in the body. There is no special mode of portal of entry or transmission of it in the body from outer source. They normally present, they are commensal. So only when there is a disturbed immune conditions, either disturbances in immune system or when the mucosal barrier get interrupted, disturbed because of any cut, abrasion, etc., they invade our body cells. These are transmitted from mother to infant in the normal course during childbirth and remain as a part of a normal flora of a human being. Here, when overgrowth of candida occur in the body, at that time one can see symptoms of a disease caused by it. So this is mainly because of a certain type of a imbalance. For example, when there is a change in pH of a vagina, at that time Candida albicans overgrow and cause a disease, that is a vaginosis, that is in the mucous lining of a vagina, entry of Candida, overgrowth of it, and then one can see symptoms of a irritation, etc., in the vaginal area. So here transmission, it's unlike other prokaryotic microorganisms. As you know, there is no animal vector for this microorganism. People acquire infection mainly in hospital settings. That is nosocomial type of infection it is. And when patients suffering from certain diseases which are related with the immune system, at that time always chances of infection by this organism. So it is nothing but a immunocompromised state of a person during AIDS like diseases, as well as during certain malignancy, such a type of a conditions occur. During the treatment with some immunosuppressed drugs, mainly that type of a drugs used for treatment of a autoimmune diseases, certain types of a malignancies, condition is appropriate for growth of Candida albicans. And studies show that about 40% incidences of a nosocomial infections by Candida in that is in hospital environment because of such a type of a situations. And healthcare workers, that is hospital staff, is mainly responsible for transmission of such a pathogens from their body to these patients suffering from certain other type of a diseases or a conditions. So here there is no exact known infectious dose of Candida albicans, and incubation period is depending upon again immune status of that person. It is caused by abnormal growth of organism, and this is mainly because of a imbalance in the environment. This imbalance occur in women's vagina, and this infection less likely to occur for men. But chances of a transmission from woman to men, they are also common. Here, Candida albicans are able to take advantage of the conditions which are present in that particular body. They outcompete the normal microflora and resulting in candidiasis, that is yeast infection. So here, such a type of a condition mainly observed in uh, certain conditions like prolonged antibiotic therapy. Antibiotics are used for the treatment of a certain bacterial diseases, because of which whatever the normal flora of gastrointestinal tract, it get destroyed because of a prolonged antibiotic therapy. And as there is no competition for Candida albicans because of the absence of a normal microbiota of a gastrointestinal tract, they overgrow, they outcompete and cause infection in the patient. Compromised immune systems can be caused by chemotherapy during treatment to the cancers. During transplantation, broad use of a broad spectrum antibiotics, which are again favorable condition, which is most important predisposing factor for the diseases by the Candida albicans. There are variety of a skin infections by the Candida. First one is oral thrush, and the most important one is a vaginal yeast infection. So 75% of a adult woman will have a yeast infection at some point. Now we'll see in detail oropharyngeal candidiasis. This oropharyngeal candidiasis is an infection in the mouth and in the throat area, as name indicates, that is infection of a oral cavity. It is characterized by the formation of white colored patches. As you know, when this organism grow in hospital environment, at that time also there is a formation of a white colored colonies, yellowish white colored colonies. Similar type of a growth occur when they infect our body cells. So white colored patches are formed on the top of a tongue. So it is just like coated tongue. And if you try to remove that particular coated portion, blood ooze out from it. So this type of a white colored growth present throughout the mouth, and it is called as a thrush, which is very important symptom or a condition in case of a oropharyngeal candidiasis. Majority of a times to the infection name given is thrush only, oral thrush or a oropharyngeal candidiasis. Thrush can be removed with blade, or it can be removed using various types of a buds, and at that time it show distinct colored redness. This is called as a erythematous type of a condition, and this infected area will cause soreness and difficulty during eating. Such a type of a thrush is widely observed in case of a bottle-fed infants. So here you can see such a type of a white colored coated tongue during infections by the Candida albicans in case of a infants. Oral thrush is, as you know, present inside the mouth, which is oropharyngeal candidiasis, name given to it simply as a thrush. And it occurs in toddlers, in infants, and this type of a yellowish bumps may appear in the inner cheeks as well as a tongue. So this is thrush. Now, second one is a vulvovaginal or a genital candidiasis. As name indicates, it is infection of a vagina, that is in the genital region. Mainly the genital walls, they are affected in case of a woman. The vaginal yeast infection causes itchiness as profuse growth of organism. The similar type of a thrush-like condition but appear in the genitalia. This leads to burning sensation of the vagina as well as of the surrounding tissues. Because of this, there is a white colored cheesy discharge in the patient in case of this candidiasis. A healthy vagina contains bacteria like lactobacilli. Some yeast cells also present, but as level of lactobacilli they get reduced because of a certain reasons like antibiotic therapy, this organism overgrow, and as that balance of bacteria and yeast get changes, okay, you can see this type of candidiasis, because of which there is intense itching, swelling, as well as irritation. This is, if you observe by various types of scopies, there is a erythema, reddening, as well as a edema, that is swelling. And that white colored discharge having yeasty odor is characteristic symptom of the candidiasis. This discharge is also called as a white cottage cheesy discharge, and it is more prevalent in women, but sometimes such a type of infection may observe in men who get contracted. Then there is a rash-like symptoms in case of a male in genitalia. Then there is one more possibility of an infection by Candida, that is invasive candidiasis, that is entry of a Candida in the bloodstream. So it is also called as a candidemia. Now here invasive candidiasis or a candidemia is, as you know, infection of a bloodstream. Via bloodstream, Candida may reaches to various organs like kidney, liver, brain, etc. And here it is nothing but a systemic type of infection. Whatever mortality or a fatality rate observed in the patient is because of such a type of a candidemia, candidiasis. Now, as candida enter into the bloodstream, pyrogenic substances are released, and certain cytokines leads to febrile illness. So, symptoms are fever, chills, then there is a fatigue, muscle ache, as well as a abdominal pain. Here, patients with compromised immune system are mainly at risk in case of this candidiasis. Next to which is chances of infection by Candida to the lungs, and to the disease name given pulmonary candidiasis. This occur very rarely and mainly in immunocompromised patient. That is mainly in the patient suffering from AIDS, one can see pulmonary candidiasis. Then in some cases, these are rarest condition, but they are observed, that is septic arthritis. Here, arthritis, that is infection of a joints due to Candida albicans. Then, because of Candida, less chances of infection of gastrointestinal tract in case of a normal healthy individual. But okay, in certain cases, diarrhea-like symptoms may observe because of a prolonged antibiotic therapy. So, all types of systems, including liver, genitourinary tract, gastrointestinal tract, respiratory tract, all may get involved by the Candida albicans and may show as a, complications of the infection present at one part of our body. So, how to diagnose this disease in the laboratory? So, depending upon infection of a part, we have to collect sample. So, if it is a disease of a gastrointestinal tract, stool sample. If it is of a genitourinary tract, discharge from genitalia, that white colored cheesy discharge can be collected, or urine sample. If it is infection of a lungs, that is pulmonary candidiasis, in the sputum sample, organisms may present. In case of a oral thrush, one can collect scrapings from the tongue or scrapings from the oral cavity for the identification of microorganism. So first step in the laboratory diagnosis is collection of a samples which are from the patients suffering from the disease. After collection of a samples, inoculate it on laboratory media. So as you know, Sabror's agar as well as blood agar and third one is a cornmeal agar can be used for cultivation for culturing of a candida. So this is not widely used method because as a normal microflora as a commensal these may present, but as you can see their number is less. The number of a microorganisms candida it is less in normal conditions, while in disease condition their number increases, one can use it. So oral and genital candidiasis is diagnosed in similar manner, that is first after culturing and then by carrying out tests like germ tube test and formation of a chlamydospores and blastospores, okay, by using various media. So this is initial part. With that, one can identify by using microscopy. The samples directly can be observed for presence of the candidal cells. So basically, based on symptoms, one can conclude the patient is suffering from this disease or a not. So after recognizing the type of a rash, healthcare providers usually scrap the affected area and the samples are studied under microscope. Vaginal samples also collected and again observed microscopically. Abundance of the microorganisms in these samples indicative of the diseases caused by them. Fungal cultures, as you know, they are avoided, but then also as it is part of the study, okay, can be performed in the laboratory. So here, blood cultures widely used for the diagnosis of a candidemia. At that time, they are present in the blood, which is not normally observed. Then cultures from sputum, urine, various body fluids can be carried out using blood agar. Nowadays, different techniques are used. They are fluorescence microscopy to detect organisms in specimen. Then detection of anti-candidal antibodies in the patient's serum. These are also nowadays included in the laboratory diagnosis. Otherwise, serological test. They are second to the microscopical observation of a candida. Then detection of a candida antigen in sera. See, normally the antigens are not present. They are commensal, but then also they unable to invade bloodstream in the normal conditions. But during disease condition, as candida may present in the blood, that can be identified by detecting it in the patient serum. Then detection of a metabolites of Candida species in patient's serum is also included in the laboratory diagnosis. Currently, there are different types of a studies which are based on presence of a non-invasive biomarkers. So, number of a markers are used for identification of candida. They are presence of a mannan, anti-mannan, and 1,3-beta D glucan. So they are can be identified, and one can diagnose candidiasis. So early clinical testing has noted the success of this 1,3-beta D glucan assay for early diagnosis of a candidemia. This one is mainly applicable for the patients in the intensive care units. Here another methods which are nowadays included in the laboratory diagnosis, that is typing of a Candida albicans strains and use of a DNA probes. These are derived from Candida albicans only. So this is a latest technique used for the laboratory diagnosis of a Candida albicans diseases. Next part is of epidemiology, that is spread of disease. So as you know, these are endosymbiont, normally present as a commensal, but then also act as an opportunistic pathogen, different type of epidemiology of the disease. As they are a top source of a fungal infection in immunocompromised people, nosocomial infections are very common. Example is of a HIV compromised patient. Over 90% will develop oropharyngeal candidiasis, and this is the important or a serious problem in the patient suffering from AIDS. On the other hand, about 75% of women experience vulvovaginal candidiasis, as well as a 40 to 50% will experience more than one episode. Means many times recurrent type of infections are possible. So in the epidemiology, we have to first write characteristic nature, that is opportunistic pathogen character of the microorganism, their role in causing disease in the person having certain comorbidity like with presence of a diabetes mellitus, hypothyroidism, as well as AIDS like diseases and a immunocompromised state. So in the epidemiology, first we have to consider number of a predisposing factors and then spread of it. It is spread worldwide, means it is not limited to one area, one country, and also it is disease of a infants, for bottle fed infants. We have to write that also in the epidemiology, as well as in obese people, in immunocompromised people, in the person suffering from diabetes. We have to add it. So here candidemia is fourth most common bloodstream infection in the US. Almost 6.9 out of every 1,000 intensive care unit patients suffer from this candidemia. So this one is a quite serious problem in the hospital environment. Rates of candidiasis and candidemia are similar throughout the world. Age group, there is no barrier for that, mainly in infants and in the pregnant woman and in the elderly suffering from certain other diseases. Chances of a weakening of immune system is one of predisposing condition for the candidal infection. So this is all about epidemiology. In the prophylaxis, that is how to prevent this candidal infection, first we have to prevent the conditions, that is based on the predisposing factor. We have to consider prophylactic measures. Means what? Here, if person is suffering from diabetes, then there should be control on the level of a sugar. Then, in case, as you know, wet conditions, they also lead to candidal infection. By keeping skin clean and dry, one can prevent infection by candida. By using antibiotics only as doctor directs is also one important point. That is, avoid that is misuse of antibiotics. Okay, that also consider importance, as prolonged therapy with antibiotic is one of important factor for the candidal infection. Then by following healthy lifestyle, including proper nutrition, is also included in preventive measures, as the good immune condition not allow proliferation of these organisms in the body. So people with diabetes should keep their blood sugar under right control. Then use of a various types of hygienic practices also help in preventive this disease. Candidiasis is most commonly treated with number of antimycotics. Antimycotics, these are nothing but antifungal drugs. So topical clotrimazole, topical nystatin, fluconazole, and topical are widely used. Topical, that is, you can apply in the form of a lotions on the affected area. In case of a genitalia, when infection is of a genitourinary tract, at that time, the swabs containing such a type of a clotrimazole-like drugs can be applied on the surfaces. Same is for the oral thrush, as this microorganism easily get destroyed by using these drugs. Okay, this is powerful antifungal therapy. Again, clotrimazole, nystatin, fluconazole, and ketoconazole. Fluconazole can be given in the body, that is intravenous, as well as in the form of a tablets, but clotrimazole, nystatin, and ketoconazole mainly for the surfaces. So we can summarize candidiasis in this way. It is a fungus that can cause infection of the skin among other locations. In normal condition, skin may host small amount of this, but in the disease condition, they multiply, their number increases when they overgrow. More than 150 species are identified according to CDC, but mainly by Candida albicans. This is all about Candida. Thank you very much.